Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back, everybody. Dr. Jitka Lom from ExpressCare is here, as she always is on Healthy Living Tuesday. Hello.
Hi, nice to see you, Jason.
All right, now you picked this topic specifically. I've never heard about this before, Dr. Lom, so please educate myself and our loyal viewing audience in what the heck trigger finger is.
Well, I chose this topic because I saw some patients with it last week, and trigger finger is actually very common. It's when your finger locks and you can't unlock it. It's stuck there. And this happens usually in older people, but it can affect people even in their 30s and 40s. And it usually comes from repetitive squeezing, cutting, doing activities that are repetitively using these joints, okay, of our finger.
Okay, so this is over time. Just
over
to be clear, this isn't something that just like lockjaw or something like that.
Sometimes it does happen that way, that
okay.
they really haven't noticed anything, and then one day their finger just locks.
Fascinating.
Yeah, and so what happens is that we have our tendons, you know, our tendons wiggle our fingers.
Mm-hmm.
There's ones on the top and ones on the bottom, and the tendons are lubricated with a fluid that is held within a sheath that covers it like a little membrane. So there's like this little string within some fluid that wiggles, and that's your tendon. And when that fluid becomes a little bit dry, there isn't as much there, then there's not the lubrication, and the tendon will get stuck. And that's what we call tenosynovitis. And basically, it's a condition that we can help people with.
Now it sounds, granted I'm just learning about this right now, it sounds like it would go on a spectrum between mildly annoying to incredibly painful if your finger is stuck in that position.
Well, funnily enough, it's not always painful, but it's of course very annoying. Sometimes it's not painful at all. It's just stuck, and you can't open your finger, and then it affects your ability to do regular things like tie your shoelaces and do up your buttons. And it can happen over and over again. So the first time it happens, people will usually unstick their finger, and that's usually not painful. But as it happens over and over again, it becomes harder for you to unstick your own finger. Then you need sometimes a little injection of some steroid medicine, or sometimes a little surgery even to help you.
My goodness. How does this differ between, you know, like I was talking about, you know, like lockjaw before, things, right. Things that are maybe caused by animal bites or bacteria that is passed on from other animals, or tetanus,
right.
things like that.
So those are like infections, right? So this one is not. It's not really painful. It's just sort of there. The finger sort of stops working. So it's not something that's affected your whole body. It's just very localized, and it can be fixed. Sometimes it goes along with arthritis. Again, it happens in people that are using their hands a lot for manual tasks, whether it's in the kitchen, or it also happens more often in diabetics.
Okay, are you able to see that it is in fact trigger finger if you take like an x-ray? Can you tell by inflammation of the tendons around it, or, you know, I mean, obviously it's not a broken bone or anything? No,
like it's not a broken bone. Sometimes a person also does have arthritis, but no, it's just basically the tendon is not sliding as well as it normally should, and then the finger's stuck. So it's really very obvious when you see the person. They haven't injured themselves, they just can't move their finger. Another thing that can happen with the tendons of the hand is something called Dupuytren's contracture, and that's something that happens more often again in people that have diabetes or people that drink a lot of alcohol, where the tendons of their palm will become very inflamed and thickened, and it'll look, when you look at their hand, they've got like almost like a ridge, like a very tight band going across their palm. And that one is from chronic inflammation of the tendon. And really what we're talking about here with trigger finger and these type of tendon problems is chronic inflammation, meaning it's going on and on and on and on until it becomes very, very thick and becomes a tight band. So when people have that, it's sort of a sign of alcoholism sometimes, or certainly of diabetes, and then we can treat it again with sometimes with steroid injections. Other times that does require surgery because it's contracting the hand. A contracture is basically when the tendon is so tight that you can't open it, you cannot straighten it out anymore.
Mm-hmm. For people in your line of work, physicians, medical assistants, stuff like that, if someone walks into ExpressCare and they're like, you know, they're not in excruciating pain, and they're like, well, you know, can you take a look at this, you know, something like that. Is this easy to diagnose, and like right off the top you can say, well, you probably got trigger finger?
Yeah, it actually is easy, and it's actually easy to treat as well. So the couple of people I saw last week, we just numbed the finger, we can do what's called the digital ring block. It's kind of fun to do for me. I put a little injection on each side of the finger of local anesthetic, just like at the dentist, and your finger becomes completely numb. You cannot even feel it at all, not the tip, nothing. And then you can manipulate the finger, do whatever you need to do to straighten it out. So it's very, very simple.
If I'm someone who has had trigger finger in the past, are there exercises I might be able to do? Like I'm thinking, like flexing particularly?
Yeah, the exercises may or may not help much. Anti-inflammatories, sometimes like Motrin, that kind of thing might help. But what helps most of all is to put a little tiny injection of steroid right in there to reduce the inflammation. Remember, we're talking about inflammation. And when I talk about that, we say, well, what is that word inflammation? Inflammation just means redness, swelling, and oftentimes a little bit of heat that goes along with a process of injury or trauma. In the case of the tendons, where there's been just a little bit of injury over and over and over and over and over till the thing becomes inflamed. All
right, well everybody please stay tuned because we are talking about trigger finger. It's a fascinating topic. We're going to talk with the doc a lot more about this when we return.